Skin cancer is the most common malignancy in the US, yet early detection results in a survival rate of 99%. Your own eyes are the most effective diagnostic tool available for early detection, turning routine observation into a life-saving medical protocol. The exam requires 5 simple prerequisites: a well-lit room, a full-length mirror, a hand mirror, a blow dryer, and a smartphone. Gathering these household tools transitions your focus from passive concern to an active, structured system of medical surveillance. Dermatologists use the ABCDE benchmark system to identify the visual markers of melanoma, the deadliest form of skin cancer. This image illustrates A for asymmetry. If you draw an invisible line down the center, the halves of a benign mole match, while these malignant sides are mismatched. Here we see B for borders. Normal moles have smooth, defined edges. These malignant edges appear jagged, distorted, or notched, as seen in this porous texture. This shows C for puller. Unusual colors are a primary warning sign, which you can see by comparing the contrasting tones of these 2 distinct moles. Finally, D represents diameter, meaning any growth larger than a pencil eraser, while E stands for evolution, as seen in this mole's changing, raised surface texture. Memorizing these 5 criteria allows you to evaluate your skin using the same evidence-based logic a clinician uses during a professional screening. Basal cell carcinoma is the most common form of the disease, and it often presents as a lesion rather than a traditional mole. This first presentation appears as an elevated, shiny pink bump or an open sore that bleeds and crusts over for several weeks without healing. The second presentation looks like a waxy, scar-like patch. These tight yellow-white areas often appear on the skin without a previous injury or wound. Squamous cell carcinoma is another high-risk growth that typically develops on areas of the body with the highest cumulative sun exposure. As seen here on the nose, the primary presentation is a persistent, scaly patch that is elevated and bleeds easily when touched. Some squamous growths develop a crater-like center, characterized by a depressed yellow middle, surrounded by a dark red, raised perimeter. Identifying these specific, waxy, crusty, or cratered textures prevents you from misidentifying early carcinomas as common blemishes. Begin the Zone 1 scan by examining the face, neck, and chest, checking the edges of the nose and the cartilage of the ears. Extend your arms to check the forearms and elbows. Lift the arms to inspect the armpits and the skin between your fingers. Zone 2 covers the torso and legs. For women, this step requires lifting and inspecting the skin underneath the breast fold. Scan down the thighs to the lower legs, checking the area around the ankles, the soles of the feet, and between the toes. Clearing these front zones establishes a visual baseline, making it easier to identify subtle, new developments during your next monthly exam. For Zone 3, use a hand mirror to bounce light off the full-length mirror, allowing you to see the areas on your back that are usually hidden. Trace a visual path from the back of the calves and knees up to the buttocks. Continue up the expanse of the back to the back of the neck and the skin directly behind the earlobes. To scan Zone 4, the scalp, use a blow dryer to part the hair in sections, exposing the skin of the head. Since hair can obscure vision, use your fingertips to feel for any hidden scabs, crusts, or elevations on the surface of the scalp. Clearing these blind spots is critical, as areas that are rarely inspected are statistically where melanomas grow undetected for the longest duration. During your scan, watch for the ugly duckling, any spot that looks noticeably different in color or shape compared to the surrounding marks. If you find a suspect mole, use your smartphone to take a clear, well-lit photograph at close range. Place a common object like a coin or pencil eraser flush against the skin next to the mole to provide a scale for measurement. Providing this reference scale transforms your photograph into a measured data point that a dermatologist can use to assess the growth's progression. By completing this scan, you have established a total body baseline for your long-term skin health. If you find a concerning growth, do not panic. Schedule a consultation and provide your specialist with the scaled photographs you've captured. Firmly, open your calendar now and set a recurring 15-minute appointment for 30 days from today. Consistent